Welcome to COIQ, where you learn how health innovators maximize their success. I'm your host, Dr. Roxy, founder of Legacy DNA and international best-selling author of How Health Innovators Maximize Market Success. Through candid conversations with health innovators, early adopters, and influencers, you'll learn how to bring your innovation from idea to startup to market domination. And now, let's jump into the latest episode of COIQ. Hello, welcome back, COIQ listeners. On today's episode, I am speaking with Sheila Loy. She is the Director of Vertical Segmentation of Strategy. So welcome to the show, Sheila.
Thank you. Thanks for having me. I enjoy being here.
Thank you. So before we get started, just tell our audience a little bit about your background and what you're doing.
Sure. HID Global powers the world's trusted identities of people, places, and things. And that sounds a little bit like our tagline, and it is, but the bottom line is that is what we do. So we provide security solutions in the identity and access management space. We've been around for 30 years, so we're a large company. There's some good and bad sometimes to a large company, a mature company, but for the most part, it's good. We have a lot of R&D, and we've demonstrated recently some newfound agility. We take to market all around the globe. We're in over 100 countries, and people probably most famously know us by your ID badge that you wear, that you tap next to a reader that gets you in the door. But we're much, much more than that in regards to identity and access management solutions. What I do personally at HID Global is manage some of the framework strategies and how we go to market as a comprehensive company into a vertical industry. And the vertical industry we're focusing on in 2020 is healthcare.
Well, it's very timely.
Yeah, we didn't know that at the beginning of the year, but yeah, we've had a lot on our plate.
So one of the things that I was most looking forward to in our conversation today is the opportunity to talk about what it's like for a larger healthcare company to, see an opportunity to innovate, and then what that process was like for you and how that might have been different than what you would have done in the past prior to the new COVID economy.
Right. So we serve the healthcare industry in ways we similarly serve the financial industry, education industry, high-tech, manufacturing, etc. Because they're all concerned with the identity being the new security perimeter. Mm-hmm. So when we work with our healthcare customers specifically, there are a whole lot of identities that you need to manage. Obviously your patients, obviously your staff that has access to secure areas, secure data, your contractors, your researchers, and your visitors who come in to, a premise. So the solution portfolio that we have in our everyday life addresses tracking and monitoring and provisioning identities of people and things. In these in these pandemic times, we saw a need of tracking people who may have been in contact with an infectious disease and be able to provide some data-driven results and reporting to the end user hospital to then mitigate the plan, whether that was a healthcare worker or whether that was a patient. And so we took and put ourselves into a rapid cycle innovation mode, and unlike our normal product launches, this one took 1 week.
That's incredible.
Yeah.
How did you guys do that?
Well, we didn't do it alone.
Right.
We have the architecture and infrastructure of a real-time location services, IoT services platform. And understanding that that is actively tracking people or things in real time. And hospitals have invested in this for years and years. So that itself is not new.
Right.
But when you take and apply it to what we're facing in the healthcare industry today, we partnered with a company also in the industry, Prompt.Health, and they did the software application to specifically monitor patients and healthcare workers in like hot zones, if you will. So that as one of the people in one of those areas reports positive that they have an infectious disease, you can then notify them, notify the people within that contact area, and put a mitigation plan in place.
Yeah, which obviously is really mission critical, right? Because everything that we're hearing and we're learning is that this is really the first step to being able to mitigate and kind of get
slow
to the
spread.
Yeah, right. Exactly.
Educate. And it was an opportunity for us to take what we had, partner with some really smart people, and literally put it in a box. Mm-hmm. So we understand the nature of crisis, right? Everyone is being taxed, everyone is wearing 2 or 3 hats, and in some cases, the place where we're actually serving the patient is in a tent in the parking lot, or on a ship, or in a hotel. And so how can you take some of that hospital infrastructure and move it to that space? So the kit was put together, and it really makes the end user able to literally open the box and set this infrastructure up within an hour or 2, and to begin capturing that data that quickly and using that data to make better decisions. So that's the context of the basic kit itself. Mm-hmm. Just giving some comparison to a normal product launch. In normal times, we have a lot of people involved. We've got market data. We've got gates that we go through, that we test, all of this kind of thing. And it takes a year, or it takes months. And I'm not saying that's bad. I'm just saying that's the norm, right?
Yeah.
So I think we kind of surprised ourselves with the ability to have a digital presence, an educational presence, a partner presence, a go-to-market strategy, all of these things, internal education and communication, and most importantly, a game plan. In a company with disparate business areas going to market on their own, I think one of the winning elements was a single point of contact, the subject matter expert who's driving the ship, mm-hmm. and a game plan across boundaries, so that it was kind of an all hands on deck approach, whereby, maybe this wasn't our day job to support this business area, but right now in these times, this is what we needed to do, and this is what we needed to do for our common end customer. And the dealers that we work with, our partners, came up to the challenge, rose to the challenge. So did the people within the organization. It was really quite a wonderful thing. It is quite a wonderful thing.
It is, absolutely. So I want to kind of go back a little bit to the beginning of this, which, again, like you said, is probably just like a week and a half ago.
That's right.
We are on the cusp of this. So who was it that decided that we need to come up with something? Was it a customer? Was it a partner? Was it someone within the organization? Was it the innovation product development team? Or maybe it was just a collective group, but who was it that said, we could possibly pivot and create something that doesn't veer too far from who we are, and be able to address a new problem that this world is facing right now?
Right. I'm going to give credit to a gentleman who runs the sales organization for our IoT services group. He really is the subject matter expert. He knows our extension of partners. He knows the product, and he knows our end user customer base very well as the industry. And when you can take that, when you've been in the industry for 20 some years, and you have all of that data, you can then pull in, hey, what do you think about? And that includes our own marketing team, our own product management team, as well as partnerships that we have been leveraging, and said, you know what, time is of the essence, which is not how we usually operate. Can we challenge ourselves to do this? So I'm assuming it's a lot of conversations, to your point, Dr. Roxy, but I'll give credit to the head of our sales for RTLS, and the one who's been running our healthcare division over there.
So, it's interesting. I'm not really surprised, because, like, just for the very reason that you just described, is that they are so close to the customer, right, that they are going to have, they're almost like the first line of defense, right? They see, they're having the conversations with the customers to hear how priorities have changed and needs have evolved. And so it's great for them to be able to report those findings, right? Even if it's not in an official capacity, back up and say, hey, I think this is, spoken like a true sales leader, right? I think this is a business opportunity.
We truly put opportunity in the back seat, which I also think is important. We want to be a trusted advisor. We don't want to sell you stuff.
Right.
We want to solve your problem. And if we can understand the lay of the land, and we can therefore rise to the challenge of addressing it in a really simple way, because your mind is busy thinking of other things, right? Then it was a win-win.
Yeah, absolutely. So let's talk about this rapid cycle innovation process. What are a couple of things, and you touched on this a little bit, but what are a couple of things that you did differently here than maybe you've done in the past?
I think we maybe were a little more lenient on gates, submission, complete review, that type of a thing, just because of the speed at which we needed to get it to the market. I really hearkened it to the federal government, and HIPAA privacy laws are utmost importance. Licensure in the state in which you practice is of utmost importance to the medical industry in general. This is not an in general situation, and let's alleviate the licensure and now we have the ability to Fargo and Moorhead, right across the river from each other. So now nurses, or physicians can go back and forth and help each other out, right? So I think just taking a cue from that, we lightened up some of those gates, some of those decisions, and I don't think I would ever say it's good enough, because it's actually a package that's more than it's even being promoted as. The partner took a product and didn't strip it down just to make it this. Instead, gave a couple extra features to the end user customers for free for a time period during this pandemic. So that's pretty cool. So I would say we probably alleviated some of the stress we put on ourselves with the process and the time of the process. I think the other thing we did was we internally educated and communicated with each other and recognized the need for all eyes to be on this project for a week. And we just put everything else, on the shelf for a little bit of time. We built digital assets to support, because you have to be able to explain and educate, right? Your end user audience, your healthcare providers, and your dealers who might be supporting them. So we built a website landing page, all the collateral, a brochure, press releases for information, and then we educated our internal teams to all of this process and collateral, and we decided on a go-to-market strategy, which heavily leverages our dealer community and our software partner.
Hey, it's Dr. Roxy here with a quick break from the conversation. Do you want your innovation to succeed, to change lives, to shape the future of healthcare? I want that for every health innovator, which is why I invented COIQ, an evidence-based framework to take your innovation from an idea to startup to full market adoption. If you're not sure where you are in the commercialization process, take the free assessment now at drroxy.com/score. Don't miss out on impacting more lives just because you have a low COIQ score. The free assessment is at drroxie.com/score. That's drroxie.com/SCORE. And now let's jump back into the conversation.
So I think that it's really remarkable on the things that you were doing, and I think that so I want to ask you this question: do you think that you could apply some of these practices, let's say like next year, when we're not in a global pandemic?
Mm-hmm.
Do you think that this will change your innovation?
We're trying to apply this.
Yeah.
With another solution as we speak. Because I think timing and relevance to the market is really half of your battle of being successful.
Yeah.
And when you have the customer centricity model for your product development and your go-to-market strategies, when their problems become things you can address in a quick and relevant way because of the times. And I'll give you another example. We've got all of these temporary nurses and doctors, and we've got people sharing and working at different sites. All of these people are being issued credentials to have identities vetted to be able to move around a secure facility. And that's become kind of messy.
Yeah.
So those are some of our core issuance solutions, and how can we get those types of solutions to market and help others solve problems in a very thoughtful way.
Mm-hmm.
So I think it's important to take lessons learned, whether it's right now this week too, or whether it's next year, and saying how successful were we?
Yeah.
What were the decision points? And how can we apply that to some of the other products in our portfolio?
Yeah, yeah. And I think what you said is really important, that this is not a normal time for any of us, right? And so the governments recognize that, and they have loosened some of the regulatory and legislator compliance issues that or barriers and obstacles that we might face on any given day. And as you mentioned, a lot of that is put in place to protect the welfare of human beings, right? So it's not that it's a bad thing, but it's been overall, a lot of that stuff has been, well, like we said, obstacles and barriers to innovation and adoption of innovation. A lot of the ideas that people have, unlike other industries that don't face some of that, bureaucracy. And so it's really interesting to see how the industry is stepping up and performing in surpassing their performance in many ways than what we've done previously, because we don't have some of those barriers.
I agree.
Yeah.
And I just, I don't know if it's patriotic or if it's sentimental, but I love when people come together and they're all, all the intentions are good and they're helpful, and we want to partner in that to the best of our ability.
Yeah, absolutely. Yep. And, maybe that's the key ingredient too for successful rapid cycle innovation is
maybe
common purpose. And the urgency behind that. So there's two other things that you kind of touched on that I think is interesting for us to talk about. So one is timing. So very often I'm working with clients and we're talking about their timing strategy, and they should they be first to market? Should they be, a fast follower, late entrant? And, the conversation now is very different, right? So obviously it depends on what kind of business you're in, but for someone like yourself, like the timing is now, right? That
absolutely. I think I think there are two answers to that question. If I had been developing a product over the course of the last year or two, and it might be relevant now, but I haven't sold it yet.
Yeah.
I don't know that this would be the platform I would want to test it. Right. But the products that we have are tried and true and purchased over and over and used successfully over and over. We kind of downsize them to a bite-sized piece that can be understood and deployed and supported simply, and created, something very cost-effective in this time for people to really get their ROI in the matter of days.
Yeah.
And partner there. So I think because the solutions were mature in themselves, we felt very comfortable bringing them to market in a little different way.
Mm-hmm.
I'm not so sure if we've got, if we would have been as quick to move if this was something that was, under the curtain
Right.
until the moment.
Yeah. Yeah.
That's just my opinion.
Yeah. Yeah. And that's a really valid point for sure. So, when I think about what you're describing on the product, there's a lot of like classic or famous examples around pivots, right? Almost every tech company that you can think of is really the result of a pivot, like Facebook, Pinterest, Instagram, all of those at one point were faced with some type of do or die moment, and they decided to, let's do plan B or let's do plan G. And the plan G ended up being like the eureka, that's the right strategy, right? And so it's interesting to hear you say that, where, most of us, feel like, oh, if we just put these added features and functionality, it's going to be more impressive. It's going to be more valuable and more impactful before we go to market with it. And it sounds like what you guys did is what a lot of tech companies do, is strip that down into something that's a little bit more manageable and bite-sized and maybe more affordable. And then there you go, a whole nother solution.
Right. Yeah, exactly. I think that was the thinking behind the contact tracing and surge response kit. It's a rapid deployment.
Yeah.
Doesn't mean it's brand new and untested. It's just been rethought through, rekitted in a new, fresh way.
Yep, absolutely. So let's talk about marketing strategy and how you might have pivoted that. So, the marketing strategies that we had in place previously aren't necessarily, they could be, but they aren't necessarily the exact market strategies that are going to be successful in this new economy. So help us understand what are some of the decisions or changes that or considerations you might have had around your brand positioning, your messaging, or how you were getting in front of folks and creating awareness and demand.
Mm-hmm. I think in, some of the things we're not willing to compromise or sacrifice. So all the right executives within our marketing team had eyes on the collateral. We did want to make sure our brand was represented in the way we know it should be. In the wording, we wanted to make sure that this is a response kit to infectious diseases, not just the ones we're dealing with today, but really any type of infection spread. And I think we moved it through on a fast track, but I don't think it means we missed checking the boxes. Our brand is important. Our customers are important, and our ability to be a trusted advisor to digital identities and digital access and physical spaces and physical access, we kind of span that spectrum. And so we have a lot of touch points and decision makers within each healthcare organization that we market to generally. It's not unlike any other large organization. We, create a campaign, we create collateral, we soft message you on LinkedIn, and we, try and get some thought leadership. I'm telling all of our secrets, right? But that's proven, and we follow the same things. So although we were very serious about what an end user or what a channel partner might be reading and understanding and making sure it made sense and that it did meet our brand requirements, I think the difference this time was we really just took it straight to the streets.
Yeah.
We reached out to our customers who are our partners in crime, and they trust us when we say, hey, I think this might solve a problem, and they'll take the time to review it. So we went directly to our end user customer partners, and we went right to our trusted dealer channel partners who also serve hundreds and thousands of healthcare organizations across the globe, by the way. And so to make sure that we just took a direct, and we got 100 of the dealers that we reached out to on Friday. We had hosted webinars on Monday. 100% of the dealers we reached out to on Friday afternoon participated in Monday and said, this is exactly what our end users are looking for. Thank you for allowing us to play in the game of being helpful.
Yeah, allowed your customers to be a hero.
Yeah, and truly to solve a problem.
Yeah.
And so it was that part was kind of cool. So I would say we just kind of went direct to the streets, and because of the nature of a pandemic, and it's you got to move fast and be agile, and we've already sold some of the products, so I think it must have worked.
I think that's huge. Not everyone goes from 0 to 60 in 8 days and then nails it right out of the gate. To be able to have, I mean, right now inboxes are just completely cluttered, right, with emails, right? So being able to promote a webinar campaign to anyone via email is a feat in itself. And then to be able to get 100% participation, to me, it speaks to the relevancy and the product market fit, right? And so, to be able to get product market fit right out of the gate within a 2-week period of completing the product and then having product market fit is pretty incredible.
Yeah. I'm very proud of HID. I've worked here for 15 years, so it's a company I love. I love the people. I love everyone's good intentions. And it sounds very motherly and matronly, I know, but I'm just very proud of our ability to pivot, as you promote, Dr. Roxy, and really prove to ourselves and to our partners at a variety of levels that we understand we have something that will help you, and we're going to make it as easy as we can for you to get your hands on it and to begin helping your staff and your patients. So pretty cool.
Well, I think that in today's world that we're living in, that there's a lot of tragedy. There's a lot of doom and gloom that's being propagated, right? And it's not just propagation. It's it's a lot of the reality that we're facing right now. And I think that for the everyday person, like, that's to me the silver lining in all of this, is to know that we still can shape the future of healthcare. We still have a purpose that gives us that I would imagine that gives your employees hope and for a better place, and then this sense of purpose, because you know that you're making a difference in a way that has real impact. And to me, it's like that hope, that purpose, that kind of mission of really, changing the face of healthcare is really powerful. And it's like, that's what needs to spread faster than the pandemic.
Yeah, it's very empowering on any side of that conversation. And, happy to have participated my little tiny bit in the whole thing.
Yeah. So Sheila, as we wrap up here, there's a lot of people in the audience. So, we have small organizations that are like startups that are, we're just getting started and completely rocked by what's happening. And then we've got some larger organizations like yourself who have been at this for a while. And I think the common thread is everyone is, I haven't come across anyone who's not looking at the pivot strategy, right? Whether it's the entire business model, whether it's a product, or whether it's like our marketing and sales, something has changed because this, COVID economy is just very different. What are some other things that you would want to leave our audience or our listeners with as we wrap up today?
Oh, I don't know that it's anything earth-shattering, but whether you're a smaller organization or whether you're a large organization, as you address the needs of an end customer, if you keep that end customer in the center of your decision-making, And if you are focusing on any vertical industry and trying to solve some challenges or partner with people within a specific industry, and you communicate. And so that everybody is understanding of the common goal and everyone is, regular cadence, pulse meeting updates so that everyone remains on the same page. When people remain on the same page and they're in support of each other's efforts, whether it's your day job or whether it's maybe the job that, you need to just do the next couple weeks here, and you do it with a smile on your face, I think that's the biggest positive that'll keep your company rolling forward.
That's awesome. Thank you so much. So how can folks get a hold of you if they want to buy your services, buy your kit, or if they want to just get a hold of you and ask you some questions?
Sure. You can reach me at sheila.loy@hidglobal.com. That's my email address. And I'm trying to see here if I have it's hidglobal.com is where you will reach the website. I don't know if I have any other particular landing page data. I can get you that and we can maybe post that.
Awesome. Well, thank you so much for being a guest today.
Thank you. I appreciate it very much. Enjoy the rest of your day.
Thank you so much for listening. I know you're busy working to bring your life-changing innovation to market, and I value your time and your attention. To save time and get the latest episodes on your mobile device automatically, subscribe to the show on your favorite podcast app like Apple Podcasts, Spotify, and Stitcher. Thank you for listening, and I appreciate everyone who's been sharing the show with friends and colleagues. See you on the next episode of COIQ.